Good evening. Welcome to the Facial Aesthetics webinar on platelet-rich plasma (PRP) by Dental Creators in association with Medical Aura. Join us as we delve into the exciting world of PRP and its transformative effects on facial rejuvenation. Discover how PRP can enhance skin texture, reduce fine lines and wrinkles, stimulate collagen production, and promote a youthful appearance. Our expert speakers will share cutting-edge techniques, case studies, and practical tips to help you achieve optimal results for your patients. Don't miss this opportunity to unlock the power of PRP in facial aesthetics. Today's speaker, Dr. Preeti Pandey, is a consultant maxillofacial cosmetic surgeon in India. She has done her master's in maxillofacial surgery from Dr. Bhima Ambedkar University and MSc in facial cosmetic surgery from Northwest International University, USA. She is owner and director of Dr. Preeti's Polyclinic in Navi Mumbai, and also she is owner of Elite Aesthetic Clinical branches in Mumbai and South Delhi. She also has strong consultation based in Jammu. She is super specialized in facial plastics, facial cosmetics, and hair transplant surgeries. She is also scientific and academic writer and reviewer for international journals. She has many publications on her credit, and she also presented her work at state, national, and international level. She underwent training and also worked with many renowned hospitals all over India, like Rajiv Gandhi Cancer Hospital, Delhi, AIMS New Delhi, GSR Hospital in Hyderabad, SIPS Hospital in Lucknow. She also underwent facial cosmetic surgeries training under Dr. Mohan Thomas Aesthetics in Bandra, Mumbai. She is associated with many organizations like IDA, NOHP, Lions Club of Aerol, the Lifeline Express by UNICEF and WHO. She has given lectures and also conducts workshops on facial aesthetics and cosmetics at various places all over India. She is also involved in many social welfare activities and associated with Mumbai-based NGOs. Now I would like Dr. Preeti Pandey to take over from here.
Yeah, hi, good evening, everyone.
Yes,
Am I audible?
Yeah. Doctor, you are audible.
Yeah. So basically, we are going to start with this webinar, that is PRP, the golden fluid for face aesthetics and rejuvenation. Okay. So as we are aware of platelet, what it is, right? Platelet is what? And how it will help for face aesthetics and rejuvenation. How does it work? And what are its function? And basically why we go for PRP, not for any other thing. So basically, what is this? The secret of younger, firmer looking skin. So how PRP works and what it is and how it looks. There are so many questions people, they keep on asking me why we go for platelet rich plasma. Why not other like PRF or any other substance for this? Okay, so basically platelet, it contains many growth factors. That is, first of all, this is homogeneous, means we take it from our body, our own blood, right? So it is prepared. So it is like completely authentic. And apart from this, it has no side effect. The main important factor for this is the patient selection, proper patient selection and proper site selection. So where we can use this, how we can use this. Okay, so and how is it prepared? So these are the big question and these are the main challenges. If we overcome this, then we can easily get a good success rate. And according to study, we have good success when we are treating patient with platelet rich plasma. Okay, so it also helps to rejuvenation. So how this rejuvenation process happens? Okay, the thing is ki it is we need at least 4 to 6 sessions. Okay, and then maintenance therapy, maintenance phase. So what we do, how we process this? The main factor after we venipuncture, when we take okay sample, I mean blood, when we withdraw, then where we have to store this, we can see these tubes, test tubes. So what this test tube contains, and what is this yellow part, what is this red part, these are very basic things. And what we have to withdraw out of it, and how we have to use it. Okay, so the foremost thing is the vials which we use, that is ACD. ACD is what? It is acid citrate dextrose, right? What does it contains, and why we need that vial solely? Why not any other vial? Because since platelet, the main function of it is a clotting factor. It contains clotting factor. So when we keep this blood in ACD vials, so it helps to prevent this clotting. So then only we can get this golden thing. I mean this yellow fluid that resembles golden color. So this is what is concentrated platelet. On an average, when we take this uh, concentrated plasma platelet, it is 2.5 to 8 times more than what we have in whole blood. So once we take this in ACD tube, that is acid citrate dextrose, right? After taking this, then we centrifuge it. Now, what is this centrifugal thing? Basically, it is like swinging out horizontally. And when it swings, like for swing also, there are two motions, slow motion, hard motion, that depends on the RPM, like rotation per minute. And it depends on composition and where we have to apply this. For scalp, we are doing, or for face, we are doing. So accordingly, we do we select our RPM. So initially, slow spin, it is like to 1200 to 2400 rotations per minute for 10 minutes initially. In this, what it happens, this erythrocyte is what? Basically the red blood cell. Our blood contains 4 components, right? So out of which the red blood cell, it gets separated during our first spin. That is slow, right? And after that, after 10 minutes, again, we can do centrifuge it for 3600 RPM for 10 minutes. It helps to separate the platelet-rich plasma with poor platelet plasma. So this is how we get this golden fluid after 2 cycles. It varies from machine to machine, what is available, and varies according to company's RPM. Okay, but this is gold standard, like 1200 to 24 RPM. This we can use. And once that is done, then from ACD, once we get this golden fluid, then this we can keep in sterile test tube. After keeping in that, then we can withdraw in needle, right? Now the second question comes is which needle we can use, right? So since we are going to inject this in very sensitive part, like in scalp, on a cheek region, so skin there, it is very thin, right? And we cannot use the 24 gauge needle or like below that. So we have to go for at least 27 to 30 gauge needle. Like we can use insulin syringe or tuberculin syringe since their gauge is very small. And that is what we can use. Okay. And after that, then we can, after loading, and then we can inject it wherever we need. Now, in our case, I have few cases also I can show. First of all, this is a centrifugal machine, and these are vials. The blue one are sodium citrate, and the other one we can use is of ACD. So this is how we get, once we place it into centrifuge, and it has directions, like we can stabilize it by keeping like 4 or 6 vials. And this is what the mechanism of action it is. So in this, I will explain the platelet concentration gradient. right? So after separation, there is a platelet activation. There are three phases. How platelet works. First phase is inflammatory, then proliferative, then maturation phase. So this is the main reason why we have to avoid giving NSAIDs, anti-inflammatory drugs, before and after the procedure. As you can see this mechanism, since it initial 3 days, 1 to 3 days after injecting, there is an inflammatory response. So in case if we are giving NSAIDs in this, then it will more aggravate, and also it will inhibit the platelet activation, platelet growth formation release. So this is how once we, after loading it, then we have to keep it in sterile environment only. We don't have to refrigerate it during the process and after the process. I mean, after withdrawal of blood and during the process, we don't have to refrigerate it. Okay. So these are few of my cases I'll show for acne scar. This case I have done in Mumbai. So this is what you can see. This is the other case. So coming to this, after injecting this plasma, why we are doing microneedling? Why is it essential? Why we need to do that, right? For acne scar treatment, basically what it is, the acne scar, how it gets resolved after plasma treatment. For this, we have to do microneedling after injecting plasma. What microneedling it does, it helps to penetrate it at epidermal and dermal level. Okay, so whenever there is a acne scar, there is one thin band formation where our skin it gets stick, right? So when we are injecting this plasma, it helps to contract this, because of it helps to break that fibrin in bands. One thing, and apart from this, it helps to uh, uh, release growth factor. So for acne treatment, we can use this plasma along with microneedling. So this is one thing. And for using for scalp, this is the other case from Mumbai. So basically in this case, there was a hairline loss in patient. Fine. So we have done, this is the result of two settings, right? So like how much we have to inject the needle and what at what level, right? So on an average, 3 to 5 mm depth is optimum. We don't have to go more deep. 3 mm to 4 mm, that is fine. Okay. We won't injure any vessels or anything in 3 to 5 mm. And like we can use fanning techniques. So for these techniques, we need to do hands-on courses or workshop. In that, you will get to learn how we have to inject it, the proper technique of injecting PRP, either on face or either on scalp, right? So this is one thing. So this is my Jammu case, and this is result of 4 months of treatment for plasma. Now patient is in maintenance therapy, maintenance phase. So this is how this hair follicles it grows, right? Like thin. A patient was having complaint of thin hairs along with partial alopecia. So we started this treatment in 2022. And after 4 5 months of treatment, like this was the result. Finally, what we got. So here this growth factor, what it does, it acts on hair follicles because of which it grows, like it helps to grow. And the thinness of hair is also get controls at some extent. So here the angulation of needle, that is also very important. Like at what angulation we are injecting and how we are injecting, right? So now coming to the risk factors. The risk factor, why it is important? Because there are so many people, like so many doctors, they keep on asking this. We are doing PRP treatment, but there is not as much as result we are getting what is required. Fine. So here the main question comes is of patient selection, right? So how we select patient, that is very important. Patient selection means patient should not have any skin disease, underlying disease, like any metastatic disorders or any blood related things, like any I mean, viral infection or anything that will aggravate. In spite of getting good result, it will get more worsen. So it is always advisable to do patient selection very properly, right? In psoriasis cases, because many times patient is having psoriasis on scalp region and that goes unnoticed, right? So that is also very important factor. For acne also, like we have to see patient is in active acne phase or in regressive, or like at what phase is. Because if active acne is there, then we should avoid doing PRP treatment initially. Once that gets regressed, then after that we can start with treatment for PRP treatment for acne scar, right? So any questions you can ask me. Any question you can ask me. The one question is, what is the age limit for hair growth? First of all, there is no age limit as such, because anyways we are using patient's own blood. But still, if we are doing uh, in 20s or 30s, then that we will get more better result compared to what we are doing in 60s. Because PRP, before it was not before, now also people they use it for many degenerative disorders. Okay, so there is no age limit as such for this, but still, like for face and all. If patient is in active stage of acne, so how can we perform face PRP? And what is the angulation of injections for hair? Just 1 minute. First of all, when patient is in active stage, right, for acne, so till then we can prescribe some antibiotic topically. So it will regress, like that active acne will stop. So once that will stop, then we can proceed for acne treatment, for acne scar treatment. Because in active acne, if we are doing, then it will be more painful for patient. Even after doing anesthesia also, still patient will be having pain. And apart from this, it will grow more. So it is always better to avoid during active acne phase. And what is the angulation of injection? See, angulation, it depends where we are doing, where we are injecting. Still 30 to 45-degree angulation, that is desired. And apart from this, the needle penetration should be 3 to 5 mm. Any chances of hair follicle infection as a side effect during the process? Yes, definitely there is chances of hair follicle infection. That is why I said no, patient selection is very important. Because if patient is already having any underlying disease, so then it will be difficult, right? Any chances of So it is always advisable to check properly, take proper history of patient, because if patient is having any psoriasis or any dermatitis or anything irritant, so first remove that. After that only we can go for it. Vertex, hairline, temporal region, crown, midline, or glands. Depends on the pattern. Exactly. The area, it depends on the pattern of hair loss, because in male it is different, in female it is different, and age wise it is different. Okay. So that depends on area and depends on patient's age. So accordingly we have to select, because this is very versatile. We cannot stick to one thing, that patient is having front hairline loss only. Like there can be male pattern baldness, female pattern baldness. How to control side effects during skin treatment? Now it depends which like what kind of complaints patient is having, right? If patient is having irritation, at some extent it is fine, because their patient is in inflammatory stage. For 1 to 3 days, 3 4 days, patient is into inflammatory stage. So till then it is fine, but still if it is persistent and if it is growing, then we need to take care of it. Okay, we can start with antibiotics, or we can start with proper analgesic, and we should address. Any other questions? Existing hair. Any chances of existing hair follicle infection as a side effect during the process? No, see, existing hair follicle infection will happen whenever there is underlying infection. Already, if patient is having some infection, and in that, if we are injecting, obviously we are causing trauma, right? So in those cases, there are more chances of developing infection. So that is why it is advisable to check patient properly before nappage fanning preferred method for hair treatment. Fanning technique, actually, that is like commonly we use and we can use it. That is what I said. It depends on area where we are injecting. And it has no side effect because since it is made out of our blood only, so there is no side effect as per any studies. But the thing is how we are using it, like the technique we are using, that is very important. Any other questions? Who can perform injectable BDS can do? See, injectables, anyone can perform. I mean, trained doctors can perform. But the thing is, you should undergo proper training and you should have proper knowledge of it. Because just treating patient is not everything. We need to handle the complications also post treatment. That is very important because this treatment, it takes time. At least we need 3 to 4 sessions for 3 to 4 months. And in the gap, like we can take gap of 3 to 4 weeks. Okay. And after that, we need maintenance, like 4 to 6 months, we need maintenance treatment. I mean, maintenance phase. So in that case, we should be properly trained before performing any treatment. Yes, both technique can be used, but fanning technique is very commonly used. Any other questions? Yes, that is why fanning, because when we are dealing in scalp region, so we cannot use zigzag method, right? Fanning is linear, means if we are treating patient's hairline, right? So in this, we not only hairline, wherever we are using, I mean, we are injecting. So a linear pattern is always better to avoid any complication post surgery, I mean, post treatment, to avoid any complication. So is it clear what is like what technique we use? What is fanning technique and why it is more preferable over nappage technique? So basically PRP, platelet-rich plasma, this is the best therapy, best treatment, and best alternatives to any other hair treatment at present because patient they like we can avoid the other side effects.
Any further questions?
Can PRP be useful in dermal burn injury in face? Yes, so this is very big question actually. Dermal burn injury, that means this is second degree burn, right? So first of all, if it is second degree burn, then patient won't be having nerve endings, like patient won't be having pain. But this is very risky actually, because in burn patient, we need to check how much, at till what extent it is and what degree of burn it is and the area it is involving. So accordingly, we can go for it. But it is advisable not to go for it. Any other questions? Meso before injectable or vice versa? Exactly what you want to ask. Mesotherapy or what? Dr. Vaibhav Jaiswal. Yes, this we can do, but that depends on patient also and how which acne scar patient is having. In every case, we don't have to go for mesotherapy, right? If a patient is in initial stage, like initially acne scars are there, then in those cases, we don't have to go for other therapies. This PRP treatment, it would be fine, right? But if there is more like what I have shown, in those cases, if it is long standing, then we can add other thing also along with PRP. Any other questions?
On behalf of all dental creators, I thank you, Dr. Preeti ma'am, on such a wonderful lecture. This is just a beginning. We'll get in depth of all subjects with each webinar. This was just an introduction to PRP. All the methods will be discussed one by one in our upcoming webinars. Thank you.